Hello and welcome to the Health Bridge podcast. I am your host, Holly B. Today's guest is Dr. Will Vanderveer. He is a pioneering psychiatrist who became discouraged by the conventional mental health care model that he was trained to provide in. After 2 decades of developing innovative approaches to address the root causes of symptoms, in 2018, he co-founded the Integrative Psychiatry Institute. Dr. Will is a leader on a mission to transform mental health care, and he has set a goal to train 10,000 providers in psychedelic-assisted therapies and other innovations by 2028. Integrative Psychiatry Institute empowers hundreds of clinicians every year how to revolutionize the care that they provide. While Dr. Will's specialty is not necessarily autoimmune based, there is a lot of crossover between how he approaches his clients in his psychiatry practice and how I believe autoimmune patients should also be handled from more of a multifaceted approach, not a one size fits all approach. So in this conversation, we really dive into the topic of trauma. We discuss what is trauma? How do we define trauma? What are the different types of traumas? And why is it so important to recognize trauma as a root cause to our current conditions, which may present as autoimmune, maybe as depression or anxiety or PTSD? Why we talk about why the approach to health really should be that multi-layered approach. Again, not that one size fits all model. And then we also discuss how the addition of psychedelic therapy may be a valuable tool in healing from this root cause trauma that has turned into this whole current cascade of difficulties that have now manifested into something major that you are dealing with in your life. I know that everyone has questions or is at least curious about what psychedelic therapies might look like. So let's jump right into this really interesting discussion with Dr. Will. Will Vanderveer, thank you so much for joining us. I know this is going to be a really, really interesting conversation for our listeners. Thank you so much for coming on the show today.
Great to be here, Holly. I've been looking forward to this.
So you have a unique model of being in psychiatry where you take a much more holistic approach and look at all the alternatives and look for root cause when it comes to working with your patients. And I first want to say thank you because I think that as well-intentioned as most or all practitioners are of all fields, they don't always get down to the root causes and aren't trained and don't know how to do that well. And so thank you for that. I'd love for you to dive in and talk about what took you from, we'll say, quote unquote, standard psychiatry practice to digging deeper and finding the other ways of accessing how you can help your patients.
That's a great question. Well, there's a great story behind that. I was a young psychiatrist, just fresh out of training, and I had started a private practice, and it was the early 2000s, and I was very excited about everything I'd learned, and I was oriented towards psychotherapy, which in the framework I was in meant that I was already a little bit out there. Like most psychiatrists were doing prescribing and 15 or 30-minute appointments. And I really wanted to go into psychiatry because I really enjoyed hearing people's stories and trying to understand what was going on, and was very interested in the way story can change a person's trajectory of their health. And I guess I should step even one step further back, that I was studying anthropology in college, and there was something very interesting to me about how different cultural frameworks are and how they can impact not just what we define as illness or sickness, but also what we do about it and how we go about healing it. And in particular, I was very interested in how traditional indigenous cultures around the world tend to have a collaborative, communal, relational, ritual way of working with something that happened to the community, like a trauma, for example. So I came out into the world and guns blazing, very excited to be a psychiatrist. And within a couple of years, I was in a very painful, despairing place, noticing that too many of my patients weren't getting better with therapy and medication. And there was one particular person who illustrates the point who was in my practice. And I had started working with him for really severe anxiety. So he had panic attacks and a lot of what I would call traditionally agoraphobia. So he couldn't go outside of his house. He couldn't go do things. He couldn't travel. He couldn't date. There was a girl that he had in mind. He wanted to ask out, but he was too scared to do it. So we were doing cognitive therapy, and I prescribed him an SSRI and a benzodiazepine. So I don't remember if it was Valium or Ativan or, Xanax, one of these drugs. And the poor guy worked really hard and got almost nowhere in a year of treatment, weekly sessions. And it's just an example of someone who invests a lot of energy, a lot of time, very committed. He would do anything I recommended that he do. And he hardly got anything back in return for his effort. So around that time, I was nearing the end of my rope in my professional career. And I had started studying meditation with a Buddhist teacher in town here in Colorado. And the Buddhist teacher said to me, I'm about to set up shop in a little town in Southwest Colorado. And would you like to come down? Because I was complaining about my career. And he's like, well, why don't you just take a year off and come down here and help me get settled in? So I quit and started meditating. But I would come back to Boulder for store runs. And I randomly ran into this former patient. And he says to me, look, thank you for the therapy. I learned some things about myself, the medications, not so much. But let me tell you what happened. I went to see a naturopathic doctor, got diagnosed with celiac disease, which is a wheat sensitivity. And I stopped eating wheat. And over the course of 6 weeks, my anxiety gradually melted away. And then I took another 6 weeks to taper off my medication, and I still had no anxiety. So that was in 2004, and I've kept up with him over the years. He's still anxiety free. He asked the girl out that he was interested in. They're married. They have 2 kids. The younger one, they both got diagnosed, or they both got tested for celiac disease as infants. One of them had it. And so none of that would have been known to him and his family if he had stayed under my care. So it was incredibly disturbing and humbling experience, but it also gave me hope. So from that point, I realized that there was a lot for me to learn about root causes that I never heard about in medical school. I received 1 hour of education, not a whole course, but one session for 1 hour on nutrition. And I went to like a top 10 medical school. So it's not like a common thing. And so I've just been on fire trying to help other practitioners who, frankly, a lot of them are in despair and burnout because for a lot of reasons. But one of the reasons is they know that the tools that they learned and that they're board certified to prescribe and so on, like I was, just don't get enough people well. And we could talk about the numbers of that, but that's a long answer to your question. How did I get into this work?
I appreciate that story so much because I think it highlights exactly where a lot of the medical system can fall short with people as specialists are trained in their one specific field and they don't see outside of that, and they don't take into account, or they're not taught to take into account, all these other factors such as diet. Something as simple as taking wheat out of your diet and how much of a huge effect that can have on somebody's well-being in so many different ways. So I appreciate that story and that you acknowledge that. And I love that that was your doorway to realizing that there's so much more and that it gave you hope that you can learn more effective tools. So, how did that take you into where you are today, actually using psychedelic therapies with your patients?
Well, I didn't hear about or get interested in psychedelics for another roughly 10 years, maybe a little less than 10 after that moment in time in my career. So I spent almost a decade learning everything I could learn about functional medicine and integrative medicine, exercise prescriptions, using specialized testing to look at adrenal health and adrenal fatigue, looking at interpreting gut microbiome tests. I mean, sending stool samples in psychiatry is a little weird, but you learn a lot about what a person needs and how to treat the root cause. So I had some success over those 8 to 10 years, but there was still a lot of people with trauma that I found, even with good somatic therapies and EMDR and highly effective trauma approaches, there were still a lot of people who weren't getting well from the traditional approaches to trauma care. So out of the blue, I got a call from a friend of mine who was a physician here in town who told me that they were looking for a psychiatrist to staff an MDMA assisted therapy clinical trial that was going to start in about 2012, I think it was. And so my first reaction was, wait, it doesn't MDMA cause holes in the brain and it's like a drug of abuse and these kids are dying from dehydration and raves and so on. And my friend said, well, read this paper that just came out in 2011. And I looked at the results, and the protocol that was being used in that paper is the same protocol that's made it all the way through phase 3 studies now. But it's a protocol of people taking MDMA on 3 different occasions, 1 month apart. And the entire protocol involves a lot of psychotherapy, but it only takes 5 months to get through. So I got involved in this study, and it blew me away to see the results that we reported in our paper that we published in 2018. It was about the same treatment response as what the paper was that convinced me to get into the work. So it was very encouraging. I thought, wow, okay, we're making advances here. And obviously more research is always good to confirm and make sure that something's really safe. But MDMA therapy, I think, is one of the biggest advances in psychiatry that we've seen in the last decade. So that was my kind of introduction into the world of psychedelic therapy.
Let's back up for a second because you referenced trauma and we haven't really gotten into that discussion yet. So, when you say, because I think trauma is a buzzword these days,
Yes.
everybody's talking about trauma, but what does that actually mean when you are addressing different patients? Like, how do you determine what trauma is, what it could look like, and how it can get rooted into these patterns that people end up needing a lot of help to overcome?
Great question. It's a really important point, and I agree with you that the word trauma gets thrown around a little too much. The other important factor is that two people can go through very similar experiences, and one person walks away with PTSD and the other one doesn't have it. So first of all, trauma is not an event. It's not an external phenomenon. The way I like to define it with our students is that trauma is a pattern of dysregulation in the nervous system that we can recognize and we can diagnose and we can treat. When something very seemingly minor, like a fender bender, 5 mile an hour car accident, sets off a rip-roaring case of PTSD, oftentimes the person who has the PTSD from that event has layers of trauma that preceded the 5 mile an hour fender bender. And oftentimes those prior experiences are not obvious until a person comes into treatment. And so from a traditional medical model, definition that there needs to be in the sort of formal cookbook DSM-5 definition, there has to be an event to make that diagnosis of PTSD. But the dysregulated pattern in the nervous system, we could talk more about that and what I mean by that if you want to, is something that you can see in other conditions that people present with. So a person who has symptoms of mood swings or bipolar symptoms, someone with obsessive compulsive disorder, someone with an autoimmune disease, someone with depression can have this pattern. And then when the pattern is addressed and integrated and worked with, usually if the condition doesn't go away completely, then it is significantly softened and a person can move forward with their life. So for me, it's really about what's going on in the nervous system.
Are we differentiating between what I've heard referred to as big T traumas versus little T traumas? And these really quick, Holly B here. I just wanted to interrupt the podcast to ask you for a quick favor. Can you take just a moment to like and subscribe to this podcast on whatever platform you are listening in on? It makes a world of a difference. And the reach of this podcast, it takes like literally under 10 seconds. So go do that right now. Thank you so much. I really appreciate it. And now back to the episode.
Right. So when I think about big T trauma, I just want to make sure we're, again, defining the terms and speaking the same language, that a big T trauma would be like a big event, like a car accident or an assault or a fall from a ladder or some other kind of environmental tragedy, like what's happening in LA right now while we're recording this. Little T traumas are the traumas that tend to be layered over time. So this could be the trauma of structural oppression in our culture. So the trauma of forms of racism that tend to be very obvious to the person experiencing it, but not obvious to everyone else. They can be traumas of being not included in school, so being left out from things. Little T traumas can also be the micro traumas that happen in relationships all day, every day, of misattunement in emotional communication. So a child who is distressed and a mother who's overwhelmed who says something just a little bit dismissive to the child because they're overwhelmed. They're trying to get from one job to another, for example. When those kinds of experiences happen on a regular basis over years, that creates a traumatic imprint in the nervous system as well. So the real determining factor is the patterning that's happening in the autonomic nervous system, what we're talking about, parasympathetic and sympathetic nervous systems, which are a very interesting thing to study, by the way. They're separate systems. When I was in medical school, it was more described as, well, here's activation and here's hyperactivation and hypoactivation. And they're two ends of the spectrum on the same scale. But it turns out that they're actually independent systems. But they have to work in harmony. And what you see when you assess these systems with technologies that are not very expensive, you can see that a person can be hypertonic in both systems at the same time. It can be hypotonic in both systems. One can be too activated and one not activated enough. But there's a symphony that happens in health where there are sinusoidal waves, a very beautiful, smooth waveform, where one or the other system is more dominant at any given moment. When I hear the train going by my office, there's a slight increase in sympathetic tone where I'm wondering my attention, oh, what's going on up there? And they're like, oh, I'm back here with Holly. So, and like that. So really these are in extreme form can take the pattern of flooding and numbing, which we see a lot in severe PTSD, where it's very difficult to function in the world because a stimulus like a train going by might flood my nervous system. or I could go into a freeze response and go into numbing and dissociation.
Okay. Yeah. That really helps to explain kind of the differences. At what point do somebody like you come in? Like
Yeah.
when does somebody already know that they have unresolved traumas when they come in to see you? Or is this something that they're coming in more for the acute reactions to things and then you help them trail it back to the traumas?
Right. I hope that one day no one will ever come to see me again.
That's
You
the
know,
dream.
yeah, the dream would be that people get access to resources and they don't need to move up the chain to a specialist like me. But sadly, we're still in a world where even though the awareness about trauma and the root causes of mental health symptoms that can be traced to trauma is rising, we're still in a massive sea of ignorance where people with chronic depression or chronic OCD or chronic panic might come to me having been told by multiple practitioners that they have treatment resistant X, Y, or Z, and nobody really went and looked to see what their attachment history was in their childhood or what happened to them. Essentially, nobody asked what happened to them. And I've been guilty of that myself as a practitioner, especially when I was a younger practitioner. So trauma is still under recognized, and I still have too many experiences of being the person to point that out.
I certainly, in my health journey, looking back in my own experience, but also especially in just going through this whole personal growth process over the years and talking with other practitioners and so many people, so many women, especially with autoimmune diseases, I've found that root cause trauma, or I should say, trauma is a root cause of the autoimmune symptoms that
Hmm.
we've developed. And it's a piece that most in Western medicine don't seem to be addressing too much, but you're speaking to it. And there are some other key people that are starting to speak to this and really start to educate on it. And I think that it can be a really empowering, actually, part of this healing journey is getting to these root cause traumas.
Right.
Do you, can you expand on that?
Well, I think one thing I'm hearing you say is that when someone helps you identify a root cause that you can do something about, it feels way more empowering than being told you have Sjogren's or you have lupus or you have some autoimmune condition that you can't do anything about. And you might as well just be a passive participant in your healthcare journey, which unfortunately is how most of our conventional medicine is set up, right? The word patient implies a passive role, and it's rude. It's Latin rude. So I think what I found is that people are really eager to do something about what they can do something about. They might be discouraged, they might feel beaten down by the things that they've been through, but to tell someone that there's nothing they can do about it is an incredibly message. So I just want to really send a message of encouragement out to people listening that there are things that you can do about your situation. And that's where psychedelic therapy has become a real interest for me because in working with a lot of people with really severe depression or bipolar or PTSD, OCD, having them trying to have a conversation about things you can change in your diet or things you can do with your physical activity or your sleep hygiene is just the cart before the horse. It's like a person who can't get out of bed to put their shoes on is not going to start doing an hour walk in the neighborhood 3 days a week or what the data may show about treating depression with exercise. So people need a catalyst. They need a leg up. They need a spark. And what I found is that if psychedelic therapy is presented that way to people, that it's not a be all end all. In other words, it's not the new Prozac, right? That it's going to have you feel less pain every day. It's just going to be a catalyst that opens up your life and gives you an opportunity to start the self-care and addressing the trauma and doing all the things that you need to do, that all of us need to do. I mean, we have to maintain our health, right? It's not given to us. So I think that in mental health care, one of the problems is that our tools suck. I mean, that's one issue. But the other issue is the messaging kind of sucks too, of you've got major depression or you've got bipolar disorder or you've got whatever. And the best you can do is just take your medication for the rest of your life. As opposed to, here's a path for you to get to well-being and wholeness. And here are the things step by step that we can do to begin that process and to build momentum. I think it's a much more hopeful message for people.
And I agree with that. And also, do you ever or can you start people, like sometimes people need to feel something right away, like they need some relief. That's usually where medication comes in, right? So
Right.
can you start with somebody like, let's do this right now, but let's discuss all these other things and these other pathways and start integrating some of those in. And as we do that, we can taper off and see how that goes. And if we still need more, we can potentially go to psychedelics or other therapies.
100%.
Yeah.
100%. That's exactly how you could work in my clinic. That's exactly how I talk with people about medication. This is probably not something you're going to want to take for the rest of your life, but it may really help you for a year or two. And with the advent of ketamine, which depends on who you ask if it's a psychedelic or not, it does cause people to have psychedelic experiences. The antidepressant effects of ketamine are so much faster than traditional antidepressants. Traditional antidepressants, SSRIs, usually 4-6 weeks of taking it every day to hope for a benefit. Unfortunately, only about a third of people are going to have a significant benefit from an SSRI. And if you look at the STAR-D study, which is the biggest study ever of kind of the naturalistic course that happens in practice, there were 4 steps in that study. The first one was Lexapro. The second one, the practitioner could give the person either a different antidepressant or add something to the Lexapro. And by the time, so the punchline is that every time you rotate into a different traditional antidepressant, there's less chances you're going to have benefit from it. And by the time you get to the 4th step, it's 12 or 13% of the people who get to that 4th step are going to have the 4th step do something of meaning for them. So ketamine, in about 80% of the people who get what's been studied in terms of IV ketamine, 0.5 milligram per kilogram, about 80% of people will have a 50% reduction in their depression within 24 hours, is what the evidence shows. So rather than waiting 4 to 6 weeks for a 30% chance, a lot of people would choose an 80% chance of significant benefit in 24 hours for IV ketamine. So that's also a place where you could say a psychedelic could play a role. And then a lot of practitioners, including myself, are not a huge fan of people being put on ketamine and then maintained on ketamine forever. It's like another mistake in the thinking pattern for practitioners. So one way that a lot of people are thinking about it, depression, for example, is, well, ketamine for a few sessions to get a hold of the severity of the depression, particularly useful for suicidal ideation, ketamine. And then in the background, maybe you're starting an SSRI that the person's going to take for 2 years. No problem. But to your point, I like to say, we're going to use those 2 years to look under every stone. We're going to address the trauma that you probably have. We'll figure out if you have it or not, but it's most likely you do. And then we're also going to look at your gut. We're going to look at your diet. We're going to see if you have genetic vulnerabilities. We're going to see if there are detoxification pathways or environmental toxins you have going on. nutritional deficiencies, and wherever possible, we'll use natural alternatives to medication. But there's often a lot to work through.
Yeah, like you said, many layers.
Yeah.
Many layers. Yeah. What clients do you see that are, or patients that do you see that are ideal for going to the psychedelic therapies?
Yeah,
Is there like a standard kind of game plan for this type of patient versus that type of patient?
that's a great question. I love your questions. It depends on which psychedelic medicine that you're looking at. So when in our trainings, we at our institute, we train people in psilocybin therapy, MDMA therapy, and ketamine therapy. And each one is a little bit different. I would say that in general, what most of what's been looked at in clinical trials, including the ones that I've been involved in, is the longer term, more chronic, you could say treatment resistant cases of, let's say, depression or PTSD. In our experience, providing ketamine to a lot of people, some thousands of people at our clinic, it's interesting that we found that people who have had longer term, what I would think of as inflammatory patterns of depression, do better with ketamine than people who have milder or shorter histories of depression. So that's interesting. I think ketamine has this anti-inflammatory dimension to it that seems to be very useful for people with high levels of inflammation. The thing about with regard to MDMA, I think it's a similar thing where all that we've seen so far is treating very long-term symptoms. So the people in the study I was a part of had on average 29 years of PTSD before they came in the study.
Wow.
And 2/3 of them no longer met criteria for PTSD after the study. So we're talking about really dramatic results. But there might be a future where I had mentioned that the protocol being studied so far is 3 MDMA sessions. There could be a future where someone who has one big T trauma and has symptoms 6 or 8 or 10 weeks later has one MDMA session and they're done. And they don't need this longer protocol that's been studied for more treatment-resistant MDMA therapy or treatment-resistant PTSD. So, and then with psilocybin, it's interesting because, again, most of the studies are on long-term depression. But what's exciting about psilocybin and very different from ketamine in the treatment of depression is that 1 or 2 sessions of psilocybin seems to last months, if not years, in terms of the benefit. So with ketamine, you have this big problem of how durable are the benefits of ketamine that tend to wear off too fast for most people. But that's not the case with psilocybin. On the other hand, a psilocybin journey is 6 to 8 hours, and it can be a lot harder to get through. So it depends on the condition and depends on the medicine. And I think at the end of the day, hopefully there are going to be very thorough evaluations of looking at alternatives to psychedelics before jumping straight to the psychedelic treatment.
Hey, I just wanted to jump in here and interrupt the program for just a hot minute. You know that I'm so passionate about this podcast, but what I'm also really passionate about is helping women with lupus minimize their symptoms, boost their energy so that they can indulge in life again. So if you are a woman who is struggling with lupus, who is sick and tired of being sick and tired, who's struggling to manage your flares, if you're finding that your lupus symptoms are just really getting in the way of you being able to live your life the way you want to, I feel you. I've been there myself and I felt the same way. And what I've found is that there are a certain set of health fundamentals that once applied will support you in your foundational health. They will support you in building and maintaining that energy, minimizing flares, and allowing you to, again, indulge in life and follow your passions. So if that is something that you are interested in creating for yourself, let's jump on a call together. I will walk you through the process that I use with my clients to get them from sick and tired to strong foundation of health by implementing my Health Bridge protocol. If this is something you're interested in chatting more about, I would love to talk to you. Apply for a free clarity call with me, and I look forward to getting to know you soon. And now back to the episode. There's what you're talking about with psychedelic treatments is a very guided, specific protocol versus obviously a lot of people dive into these things themselves for recreational purposes or because they hear that psilocybin can really help. So they just go all in on their own. Or maybe they find a shamanic practitioner that can lead them. Can you talk? I know we're getting close to time here, but can you dive into the differences there a little bit and where one journey might work for one type of person, another type of person might really benefit from a different style?
Yeah, I'm so glad you brought that up. It's something that happens a lot when I'm out in public somewhere, which is not all that often actually. But if I'm on a flight or something and I'm telling somebody what I do, oftentimes what happens is I hear about people having used psychedelics in a recreational setting a lot. Like maybe they've gone to Burning Man or they did it with their friends in college or high school. And I can honestly say that I think there's only one person I've met who felt like they had actually resolved trauma or something challenging in their mental health in that setting. It's really unusual. And it's actually, unfortunately, it's more common to see the kinds of cases that I've seen in my practice a lot where someone was at a party or they were at a concert or they were in a situation and their friend said, "Hey, I've got some psilocybin. Let's take it. It'll be great. We'll listen to music." And pretty soon the person who took psilocybin is having a an emergent experience of trauma and nobody's around with any training to support them in that. And it can be really scary because I say you, not you, but a person in that situation will oftentimes try to muscle through it and not even tell anybody what's happening. And meanwhile, they might be having a terrifying experience. And sometimes, I'm thinking about one particular case where I worked with someone who had PTSD from taking a psychedelic at a music festival, getting really scared and paranoid, and then doing weird things that got the attention of law enforcement and then ending up in handcuffs, all because there wasn't the support that this person needed, just having a weird experience on a psychedelic. So recreational use carries a lot more risks than doing a a journey for healing purposes in a safe environment and also with people who are very well trained, including training and screening people. Not everyone should take a psychedelic. There are conditions that where someone might have a very severe reaction to a psychedelic. There are medications that don't play well with psychedelics and so on. So it's a very powerful tool, but it's also a really potentially dangerous tool. And so having said all that, it's also really interesting when you meet someone who has had a lot of recreational psychedelic experience, and then they finally, for the first time in their lives, go and have a therapeutic guided psychedelic experience, and the whole experience is totally different. I mean, I've heard this so many times from people. Wow, it didn't even feel like the same kind of thing that I was going through because in a safe set and setting and with the right intention for healing, your mind relaxes and things can come up that are not going to come up when you have to pay attention to what's happening in your environment in a public setting, for example. So the third setting that you mentioned, the ceremonial or the religious or the traditional ceremonial sessions are potentially can be extremely beautiful. I mean, I've had the privilege to sit in ceremony in South America and also a few times in North America in the Native American church and peyote church ceremonies that occur in teepees and completely above board, completely legal in North America. And the setting has a religious connotation to it typically. So there's a cultural context. And as a European origin, white Anglo-Saxon, Protestant, privileged person in our culture, I have felt, I think, hopefully appropriately so, felt like a guest in those settings. And I've had incredibly powerful personal healing in sessions like that. And the only sort of caution I would offer to people listening is that there are people who are not well trained, who haven't spent time in a traditional apprenticeship model, which is pretty standard across different cultures. And I say standard apprenticeship, I'm talking about people who've spent 10 years their under the guidance of their teacher, shaman teacher, and undergone hundreds of ceremonies themselves personally before they're authorized to deliver one without their teacher there. So because of the popularity of psychedelics and a certain kind of informality that comes from maybe mostly the excitement that people have about the potential for healing, there are settings popping up all over the place where someone who lacks experience is trying to hold a ceremony or a healing session, and they may misinterpret some of the things that are happening for the people who are participating. And unfortunately, harm can happen when it's not to say that a therapist can't cause harm either, right? Harm can happen in any setting. But I would, if you're gonna go to traditional ceremonial settings, first of all, I would just be very careful about vetting the person who's leading those ceremonies.
Yeah, I think that's very, very important. There's also something which, in regards to going through a journey, there's that piece after. It's like, what do you do with
Yeah.
this after you come out? I know that you speak to the integration process of the realizations, I guess, that you've had during this journey. And just the way I see it is like, just because you've seen the light doesn't mean you've been shown the way, right? So you can
So
see,
true.
you can have the light bulb, but you don't necessarily know how to like actually integrate that piece of knowledge into your life and actually shift things.
It's so true. It's a great way to say it. Another way that I often say it in teaching people about this is that the state change is not the trait change. So having a state change from the acute effects of a psychedelic can open up insights and new understandings, and like you said, can illuminate something about you. But the hard work and the essential work is in the integration period. And unfortunately, that is really underemphasized across the board in all of these settings. So there's a Buddhist teacher named Jack Kornfeld who has a book called After the Ecstasy, the Laundry. He wasn't talking about MDMA. He was talking about mystical experiences and meditation. But the same principle really occurs, is that we need to we have to redefine, we have to do the hard work of reinventing ourselves through establishing new patterns of action, new patterns of behavior. And one of the reasons why it's hard is because our personalities are based on automating the way that we are in the world and with each other, and automating our responses to the people we care about. I mean, it's bleak and sad to say, but the more time we spend in a relationship, the more assumptions we make about how that person acts and why they act that way and what they're about to say. And it's a part of the wiring of the brain. It's not a character defect that we act that way. But we have to commit and apply effort, which is part of what I love about your message, is this message of empowerment through making a choice of taking your destiny or your future into your own hands, right? And the more people do that, the better outcomes they get, of course.
Yeah. Yeah. And the more tools that we can share on platforms like this of different ways of empowering yourself is
Yes.
is so important, I think, because just the more we can have conversations like this, the more people can learn and they can have confidence just trying something.
I love that concept of just trying, because in the depth of long-term challenges with mood or anxiety or whatever ailment we're dealing with, it could be a physical condition, we can get very discouraged. And it's I had a therapist who said to me one time, when I was seeing him in his office, you come to this honestly, right? That you come to a feeling of despair or hopelessness from very deep suffering, right? But the the way I think oftentimes the way through the darkest places is through relationship and through sharing our stories and through having people reflect our goodness back to us, that can inspire us to actually take those steps that are hard to take to reinvent ourselves. So I've come to the conclusion, or my working hypothesis, I'll say, is that we are deeply relational organisms that heal in community and in relationship. And sharing these pieces of information, like what you're doing with your show, with each other.
Couldn't agree with you more. And I think that's a beautiful place to come to a close here. Where can people tell people about your institute and where you're at with all of this and how people can find you and learn more.
Yeah. So for folks who are looking for a practitioner, whether it's integrative mental health care or psychedelic therapy, we have a practitioner directory on our website. It's in the drop-down menu on the homepage, and the homepage is psychiatryinstitute.com. It's a mouthful, but 2 words. So psychiatryinstitute.com. And then if you're a practitioner or a provider and you want to find out about the programs we offer, then you can also find that information on the same page. So we teach doctors, nurse practitioners, and therapists these more advanced skills for resolving mental health conditions. So
Cool. Yeah. Thank you so much for bringing this information not only to our listeners, but also to other practitioners that are committed to making a difference in people's lives.
Thanks, Holly. It's been really fun to be with you. I look forward to more.
Awesome. Well, thank you so much for joining us and can't wait to see what comes from your institute over the next several years.
Thanks, Holly.
Thank you. So just to continue what we were just talking about at the end there, the topic of empowerment, that really is what these conversations are all about. It's in order to open doors for you. If you're going through any kind of struggle, mental health struggle, physical health struggle, emotional, spiritual struggles, I really just want to encourage you to take that first step. Just take that first step in whatever direction you're drawn in, because it is possible to heal. It is possible to feel better. It is possible to learn how to manage your life in a way where the symptoms of whatever it is that you are going through can calm down and be nourished instead of agitated and triggered. There are so many ways to approach healing, and I'm so grateful for people like Dr. Will who take this more holistic, integrative, full spectrum approach to working with his patients, and also now for him especially, teaching others how to maximize potential healing with their patients by adding in other integrative practices to their standard medical treatments. I think these are missing keys in today's healthcare system. And I spoke to this in my last podcast as well. It's so important to step outside of our own box of what we think is reality with our symptoms or with potential healing or with what modalities we assume will be the ones that will heal us. Most often it's going to be a combination of so many things that brings healing and relief rather than one size fits all model. And that tends to be the Western medical system, is a one-size-fits-all model. And if you don't fit in the box, then there's something wrong with you, not the medicine, right? I know a lot of you can relate to that. As you've seen in this conversation today with Dr. Will, there is so much more to the conversation of healing than meets the eye. And so if you are in a situation with your care team and you don't feel like you're being cared for to the level that you are looking for, I invite you to interview other doctors, interview other practitioners, try different things out, and find that care team that will have your highest and best at the forefront of what they do with you. And I would also say make sure that you find practitioners that have a sense of curiosity and open-mindedness, because those are the ones that are willing to ask the questions that can lead to answers. So if you are stepping out a little bit and trying new things, I invite you to jump on a call with me and we can take a look at your health strategy currently and see what might be some game-changing shifts for you that can only enhance your health and well-being. Also, if you are interested in testing out the waters with potential psychedelic therapies or are looking for other mental health resources, please do follow up and look into Dr. Will's website. It's a fantastic resource to have. And for anybody that you know that might gain from hearing this conversation, I do ask you to please share this episode with them. The more people that we can inform that these things even exist, let alone can be very safe and helpful, the more empowered we are as a community. So thank you so much for listening into this episode, and we will see you again very soon on the next episode of the Health Bridge podcast.